Hi again. Welcome back to part 3 of electrosurgery demonstration and discussion. In the last part, we discussed about the monopolar setbacks and dangers. And to cap it up, I gave a few tips on how to use the monopolar safely. So before we start off with this episode, I would like us to go through a few discussions like what are the variables therefore on this electrosurgery use that are dictated by us as the surgeons. Number one, the power setting that you change here. So it's important to know that most power settings that we would work with when we are using in an actual surgery would be preferably based on the manufacturer's recommendations, but the settings would be around 30 to 35 max, and we would work with an effect of around 2 or 3 in most cases. Same with the coagulation mode, 30 to 35 max. And when you come now to, and different machines have different settings, but majority of them, the new ones, would actually work with around that. So the key point is follow the manufacturer's settings guidelines. Second rule is use the lowest setting possible to actually give you the effect you want. So don't go too high. If you can get an effect at around 20, 25, 15, please work with that. You don't need to necessarily use a higher setting. Now, today we're going to be discussing about bipolar energy. So bipolar energy or bipolar circuit is a different circuit. So let's start off with the circuit first. So what is bipolar circuit? You can see in this generator, electrosurgical unit, we have monopolar on this side, and we have bipolar on this side. So these two are settings for bipolar, these two are settings for monopolar. In these bipolar settings, we have the circuit like this. So we have out through the bipolar using 2 electrodes, coming in through the instrument, going in through one of the arms of the instrument, through the tissue, into the other arm of the tissue of the instrument, and back here, back to the generator. So with bipolar, you therefore do not need a return electrode. We can work with bipolar even here. So if I can show you, this is bipolar. It will work wherever we want it to work. So here it is working. So you can see there. So same thing, it can actually work here. So you can see there, burning. There. So bipolar does not need the return electrode. That's number one. So the circuit is basically, as we have discussed, the circuit is instrument, electrode, tissue, electrode, back. Okay? So that's the first thing. When we come to bipolar, what are the advantages of bipolar circuit or energy? Number one, it eliminates capacitive coupling. It eliminates alternating stray current pathways that it can look for an alternative way out, because it will always only go through the two electrodes, and it will only act on the tissue that is between these 2 electrodes, not anywhere else. The third thing is, it is usually requiring a low power setting. It is very precise when it comes to, because it only works through the instrument, not anywhere else, and there is no need for a return electrode. But the problem with bipolar is it definitely is not as versatile an instrument or energy as monopolar. Monopolar can be used to coagulate or desiccate. It can be used to vaporize or cut. It can be used to fulgurate or spray. It can be used, so it has very many uses. Whereas when we talk of bipolar, we are mainly going to be using it for coagulation, and desiccation mainly. Nowadays, we do have the bipolar shears as well, which can be used for cutting, but otherwise it is not a very versatile energy source. So, if that is so good about the bipolar, then does it have any negatives about it? Yes, it does have a few negatives about bipolar as well. Number one, the pitfalls are varied application times or varied application styles. So what do I mean by varied application? Well, you see, this is demonstration of now bipolar in use. So you can see between the two instruments as I continue, it will start burning the tissue. As you can see, it's smoking there, and it hits it up, okay? So it will burst the vessel or any structure that is between the two probes. So that is about the bipolar energy and how it works. Now, let us go on further. I told you there are few issues about how the traditional bipolar is not the best way of working it, because different people use it differently. So this is one way of using it, where you will see one person just use it continuously until everything is burnt and black and charred. And then there is another one who would use less and stop and cut and will start bleeding. Then there is the right way of using it. The right way of using it is pulsatile. So you activate it, stop, activate it, stop, activate it, stop, or activate it constantly but hold, cut, hold, cut, hold, cut, hold, cut, hold, cut. So you're moving the instrument to burst different areas. So the negatives about traditional bipolar is how much pressure they put is different. How they apply it, how long they apply it is different. Then we have issues with the lateral thermal spread. In bipolar, the negative about the traditional bipolar is if you buzz here, it buzzes and it burns almost to 5 to 7 millimeters on either side. So if you're very close to a vital structure like the ureter or the bowel, and you're burning for a long time, you're actually getting the tissue around get hot and burn as well. So these are negatives about bipolar, which we need to therefore understand and then work with. The other negative is, I told you, it's not the best tissue, it's not the best energy for cutting. It's not a good energy for dissection. So this is better with the monopolar. However, with newer bipolar, we have newer improvements. So what are the improvements we have? The first generation is what we are talking about, and it is basically physician controlled. Get me that? Physician controlled. So this is a physician controlled instrument. Then it's the traditional bipolar, conventional bipolar, or first generation bipolar. Then we have the newer generation bipolars, where we have second generation, which is a smart generator controlled. So this is a smart generator controlled instrument. This is a smart generator controlled instrument. Enseal, so examples are LigaSure, Enseal, we have the Thunderbeat. So these are all Gyrus PK. So these are all the newer generation vessel sealers, which are advanced bipolar. So what is different in them? Number one, they have an audible feedback. So they give us a feedback on when it's ready. So once it's pressing it active, after a while it tells you, and you know that it has buzzed enough and you are ready to cut. The second thing it has is it gives you a better seal, the pressure seal of a vessel. So like LigaSure can seal up to a 7 millimeter vessel safely. So with that, you get what is called a combination of traditional bipolar and pressure. And that causes a fusion of the vessel as opposed to the traditional bipolar, which works by forming a thrombus at either end of the vessel where you've burnt it and then you cut it through. So that is the second generation type of vessel sealers or advanced bipolar. And we have third generation as well, which is now the electrode control. So electrode control is like in NSEAL, where this is the NSEAL. Here it is electrode control. So you have small nanoparticles here which actually control the heating, and it makes sure that there is no lateral spread. It has the very little lateral spread of energy. So we have again the ligature, we have the NSEAL, we have the gyrus, and we have the thunderbeat, which is actually a combination of two energies, which we will be discussing. So this is about the bipolar energy. The advantage with the newer bipolar is, one, it is a better vessel sealer. Two, it uses lower voltage. Three, it has a feedback mechanism telling you when something is ready. And four, it's automatically pulsed. So even if, the way we said with traditional method, you want to do it in a pulsatile fashion, on, off. In this one, even if you're constantly pressing it, the machine itself is doing it in a pulsed form. So the pulsatile nature is very important for bipolar. The bipolar shears is used even for cutting. You get it in various different forms, but the shears can be used for dissection and cutting, whereas these traditional bipolars cannot. These advanced bipolars can obviously do the sealing as well as cutting, because when you do that and you now activate this, it's a blade that goes through and it cuts the tissue that you have burnt. The same with in the NSEAL, it has a blade. The gyrus, it has a blade that goes through. So with this, I think we come to the discussion and the end of bipolar. The traditional or the tips finally before we go into use of bipolar, please, number one, use the lowest setting that is effective to give you the effect you want. Two, use it in a pulsatile manner. Three, when you're trying to buzz a vessel, don't buzz a vessel with too much of tension. It will not buzz that well. When you've held it, you release the tension and buzz. Four, clean your instruments regularly to avoid buildup of eschar. Five, if you want to reduce eschar formation, please give me that instrument. One of the tips is, please understand, when you start buzzing, you will realize, if you see here, you will realize that this is what's going to happen. So first you will start activating, it will get heat. You will see now there are bubbles that form. The bubbles get bigger and faster. And after a while, the bubbles slowly go down. And that's the time, it's called the end of vapor phase. You would want to buzz and stop buzzing at that point. So you stop it at the end of vapor phase, but remember you have to do it in a pulsatile manner, up and down. Finally, if you want it not to stick to the surrounding tissue, this is what you would do. Stick to the eschar buildup. So you would hold, then activate. When you want to release first, then release your foot switch. I'm repeating again. Hold, activate, but don't leave this before you release this. Because when you release this, this tissue cools down on this hot electrodes. And when you remove it now, it will stick here. Okay? So if you don't want it to stick, activate after holding, but release before releasing. So when you release before releasing, there will be steam around. You see there is steam around, and then when you release it, there is still steam around your electrodes. So you remove it, and it will still have steam around it, and it will not stick to the tissue. So hold, activate, release, then release your foot switch. If you do it in that fashion, you will not need to repeatedly clean your instrument. Another thing is, you only activate it once you have held a tissue. Do not activate it in air. It's not right. And finally, Your target with this, when you're trying to burst the tissue, is to get desiccation, and therefore you get blanching and not charring. Your target is not black tissue, it's not carbonization, it's not eschar formation, it is nice white blanching. So it means you have devascularized the area, then cut through, you'll not have bleeding ever. So that's the right way of using the bipolar. Thank you very much. In the next class, we're going to be discussing about ultrasonics and ultrasonic energy as we wind up the energy class and demonstration. See you next time.